So here's another case. This is from our Russian clinic here. This gentleman has a fever of unknown origin after having coronary artery bypass graft surgery. He is in ICU. He is 75 years old. He is already on the vent for 8 days after surgery, and he is not getting better. So they don't know what's going on. He is already on Primaxine and another antibiotic. So they're doing everything they can, and it's not killing whatever infection he's got. So the wife comes to me in the clinic, and she's begging me to come. I usually don't go to hospitals. I just hate hospitals. Okay, so we go to the hospital. So I look at the patient, and I see that one side of his face is red, and the other is white. So it's kind of strange. And then the nurses tell me he is very irritable. Now, the guy's got a tube in his throat. You know, I would be irritable, too, if I had a tube in my throat. But you got to listen to the nurses. The nurses know who is more irritable than usual. So I listen to the nurses. So he's very irritable. So my prescription at this point is Chamomilla 200C every hour, a pellet on the tongue, until he's better, and then stop it. Okay? Chamomilla is given to people who are particularly irritable. They're angry, and a lot of these kids with ear infections, they cry like crazy. Now, there's two kinds of cry, you know. A kid that cries like, oh, you want to hold them and you want to hug them and they feel better when the mom holds them. That's pulsatilla cry. A chamomilla cry is the kid that cries so bad, then you pick them up and they cry even worse. You want to throw them against the wall. Right? So that's the impression I got from this guy. 200C for the power. I didn't want to go too high. But at the same time, I wanted to have some, it's kind of medium potency. So the follow-up was like this. He was extubated and out of ICU by next morning. So a very fast improvement. He improved further for a few days. And then on about third day after transfer out of ICU, the wife called that he is just totally impossible. So he is just, he just swears and he curses and nothing pleases him, everything's bad. So what's going on? Well, I go and ask, and it turns out the nurses did not read what I said. I said, stop when he's better. No, they keep on giving it. They keep on giving it and giving it and giving it. And so now we're seeing a proving of chamomilla, which is how we do provings. We overdose with homeopathic remedy. And so now he's proving chamomilla. He's becoming a real pest like chamomilla is. So we stopped the remedy, and within a few days, he was fine, and that was the end of it. There's another good hospital. There's nothing in this stuff. So how does it work, and where? Obviously, it doesn't work on anything that we're familiar with. It does not work on the molecules of the body. It does not work on the structure. It does not work on any kind of electrical mechanisms in the body. So what I put down here is a kind of my view of what this is a philosophical construct, if you wish. But this is how I see it. We have a soul given from above, which is perfect. And the soul needs to operate in this realm, in the physical body, which may or may not be perfect. And it needs to do what it's supposed to do here. I don't know what we're supposed to do here. But what we have between the soul and the body is what we call vital force. It's like the software which is between the computer operator and the computer hardware. So our Windows software or in whatever word processor we got in that box is what's allowing us to type in our document and then have it printed on the printer. And whenever we have any kind of bugs in the software, things are not going to work right? It's the same here. The body has this software we call vital force. If there's bugs in the vital force, we're going to start seeing symptoms on the physical level in the body, right? So we can address it in different ways. We can treat it at the level of the physical body, or we can treat it at this level, a little bit higher. And this is where we think homeopathy actually works. I searched the Google images for a monster. This is the best I could come up with. So we've got a bug or a monster in the vital force. We have to eradicate it. So this is what homeopathy does. So take a look at this lovely picture and imagine that this structure is our disease. We have all these vines growing on this thing, right? And we don't quite see what's supporting these vines. So this represents the diseases that we might have, and the support that we are not seeing is that energetic disturbance in the vital force, those bugs in the system, that are allowing our physical symptoms to appear. And that's what we can see. So all these vines are all these separate little diseases that we have. Okay, we may have a diabetes vine, and an asthma vine, and an eczema vine, and a migraine vine, etc. And yes, you can give drugs to deal with these individual things. So you can, it's like cutting the vines down. But what happens when you cut the vines down? Either that one is going to grow right back once you stop the drug, or something else is going to grow back in its place, because, you know, nature doesn't leave anything empty. And we believe that homeopathy actually works at the level of the support. So if we can actually remove this metal support from under this structure, the whole structure is going to fall down. That's what we try to do with homeopathic remedies. And this is back to the painting. There's something in it that is not readily evident, but once you look at it long enough, you can see it. Does anybody see it here? No? Yeah. Take a look. Imagine this green thing is a tie. And here's a lapel of, or collar of this guy's shirt right here. This is his neck. That's his chin, mouth, nose. You see the face? Yeah? There's more here. This looks like a hat of some sort, kind of wide hat. And then there's something here. Look at this. Do you see it? There's a horn. There's another horn. There's an eye. Another eye. There's a snout. You see the bull? Right here? The bull has got these things stuck in his neck. See these? It's laying in a pool of blood. As you keep on looking at this, it looked initially like a whole bunch of junk. It didn't make any sense, right? And yet, as you keep looking, you develop an essence. There's an essence to this picture. There's something in it that makes sense. This is what we do with patients. The patient comes to me, and we sit and talk for a while, and we keep on talking, and I'm trying to figure out what's the offness in that patient. What's off? What's weird in them? What kind of strange thing? You know, that's what we call disease. And as I'm able to figure out what's strange, we can then figure out a remedy that actually fits the whole case, everything, based on this essence that I'm seeing, just like in this painting. If I get it right, we start seeing, and usually this would be a chronic case done this way, we start seeing slow improvement over months. And if I get it wrong, nothing happens whatsoever. So basically it does not work. So then I have to work harder next time and try to figure it out. Sometimes I get it right, you know, in about 75% of cases in my practice, I get it right on the first try. And then some more percent, maybe 2 or 3 more tries. And then some people I have to work with for a long time. The longest I've ever had was my wife, which took me 15 years to figure out. But I tell you, once you do, it's a life-changing experience.